with the onset of the pandemic, people's anxiety has just escalated because of the unknown of how long the pandemic is going to last, the information that you receive about COVID-19, to wear masks, and how you have to social distance. Your whole way of life have changed. Your kids are home, you're working from home, and all of these things are taking place in a concentrated area. Everything is in the home. So clearly that is going to, your anxieties will increase, your interaction with people will become more tense because you're home with your kids all day, you're home with your spouse or your partner all day. For the last 6 months, it has really been unfortunate. In my private practice, like, most of my couples are like on the verge of divorce or breaking up because these are people that have been together for 5 years, but this is the first time they're literally stuck in the house for 3 months. And could you imagine what that brings up? We've seen an uptick in alcohol abuse, drug abuse, domestic violence. Think of a domestic violence situation where the perpetrator is in the house with the victim. Most times the victim probably get a release by going to work, but now they're cooped up in that space for 3 months with nothing to do, nowhere to go. So we've seen a real uptick in domestic violence, drug abuse, substance use, alcoholism as well. So the pandemic has really forced us to look at mental health in this broad capacity, but in a very unique way. And if you're also affected by this pandemic, if you're poor and you have a lack of resources, and because now food is limited, other resources are limited, people are losing their jobs, they're working less, so that also impacts one's mental health and how you interact with the people around you, your spouse, your partner, your children, etc.
If there are specific signs that you can let people listening to this know that they can look for, then you can let us know what those are.
I think any signs that is not the baseline of someone's functioning. For example, if you have a coworker and they normally come to work pretty engaged, pretty happy, and all of a sudden they're withdrawn, they're not engaging in conversation, they have a sense of gloominess. I think those are signs that you can look for in terms of if you're in a home with someone, they're not sleeping well, that they're not eating, they're not interacting, they're probably drinking more, all of those things, anything that would be outside of the norm for someone that you know well. I think those would be warning signs for us to engage that person.
Now, can you tell us what we can do during this pandemic, particularly against the fact that we have limited access to services, we have to adhere to stuff like social distancing, we can't gather in large crowds. What exactly can we do to protect our mental health from getting bad in the first instance? And then once we realize that it's under threat, what do we do in that instance? How do we, what should we do to cope and to get better?
I think one of the fortunate things about social media, it has allowed us to use that as a way of connecting. Like, you can have Zoom family meetings, and you have to think about the stress this creates in someone where, let's say, someone they lose a loved one. Basically, you would go to their house, give them a hug, take some food, sit with them. In this pandemic, it doesn't allow us that virtue. You really have to think people, and it would really be communication, calling them on the phone, FaceTime, and assuring them, I'm here for you. I understand what you're going through. We are in this together because this affects us all. This pandemic is affecting us, and reach out to each other. So that's an added burden for in terms of going through a trauma, and you don't have the support that is needed to help you through. So I think those are things that we need to be conscious of, and just having conversations like with your neighbor, because you're in Guyana, you could talk from your window. That's enough social distance in that. Ask them how they're doing, if they have food, whatever you can do to ease the stress for someone else, and you're able to do that, I think that it would be of tremendous benefit.
We're still threatened by COVID-19, and we see across the world, the US and Guyana, governments looking
Correct.
to reopen the economy. And that reopening the economy would result in a relaxation of some of the COVID measures and allow people to gather and go back to work and conduct economic business. Do you support the reopening of economies?
I think I do support it, but it has to be done responsible. It has to be done in a responsible way. Because opening up the economy and not enforcing social distancing, encouraging people to wear masks, not allowing them to gather in more than 10 to 15 persons in spaces, that is good. But if you open the economy and people are just flowing in droves, it will spread the virus. The pandemic will be worse. It would last longer. But these are things we can do in a responsible manner. And I always advise everyone I talk to, follow science. Follow the science, speak to your public health officials, and follow their guidance. It's imperative that the economy opens. It's imperative that people get back to a commodity of what's normal in their lives. But I do think we have to look at what's the new normal, and find ways to enforce that. I'm aware that people have pandemic fatigue because they've been locked up for 6 months and their whole life has been changed. That is understandable. But from a public health perspective, it's important to empower people with information that will help them and that will support them, and to provide support for people that are fatigued, because this is real. Our whole lives have been turned upside down.